Hormone replacement therapy in women's had a bad name since a large trial showed that it caused breast cancer and increased the risk of heart disease. But those were female hormones. But what about the male hormone testosterone? There is evidence that it could be of benefit to women.
People generally are not aware that testosterone is an important female hormone. Women actually make estrogen in their bodies from testosterone. At any one time, a healthy young girl has more testosterone circulating in her blood than she does estrogen. Now, across the board, women's hormone levels, testosterone levels, decline with age. So by the time a woman hits about 40, her levels are about half what they were when she was in her 20s. So the question is not what the level of testosterone in the blood is, but whether low testosterone is causing the symptoms. And that can only be determined by really looking at the full picture of any individual. We did one particularly large study where we recruited 800 postmenopausal women across multiple countries. And women were randomly allocated to either receive a placebo patch, skin patch, a testosterone patch in a small dose, and a testosterone patch in what we call a 300 microgram dose of testosterone. And these women wore these patches for 12 months, not knowing what treatment they were on. And by the end of the study, we found that the women treated with the 300 microgram testosterone dose had significantly greater desire, arousal, and other parameters of sexual well-being compared to the women on placebo. So what our group is doing now is a specific study looking at women who have experienced loss of libido or loss of arousal in association with treatment with an antidepressant, and we're randomly treating them with either testosterone or placebo therapy to see if testosterone will help these women.
And safety? Some people say that testosterone is related to increased risk of heart disease or some cancers.
The evidence as we have it today suggests it's safe. There is some very limited data looking at breast cancer not showing an increase in risk. And from a cardiovascular safety point of view, most of the data is from what we call observational or population studies. And again, none of these studies suggest any significant increase in risk of cardiovascular disease. If a woman takes too much testosterone, she will get acne, she will get hairy, she will get voice deepening and other changes that make her more male-like. So the critical thing is that if testosterone is prescribed for women, it is prescribed in a dose specific to achieve female blood levels. And that is why I really do not like to see women being prescribed testosterone products that are actually designed for men.
Increasingly, women are going out and getting what are called bioequivalent hormones from compounding pharmacies. And Professor Sue Davis thinks there's a real risk in this.
There are a lot of people who are turning away from traditional medicine because they have concerns and taking prescribed hormones that are compounded up individually by pharmacists from raw materials that have not necessarily been tested, and then taking them as replacement. Now the real concern is that some of these products are not exactly bioidentical. So for example, people are taking pig thyroid extract or beef thyroid extract, which hasn't been tested to get the correct dosage for people, and people are often taking it for the wrong reasons.
Just to be clear what we're talking about here, women get a prescription for so-called individualized hormones, which they're told are safer than the real ones. They go along to a compounding pharmacy who makes it up for them. With me is Karen Carey, our Consumer Affairs reporter. It's not necessarily safe, is it, Karen?
That's right, Norman. I think that people would be shocked to find the safety issues that are involved with compounding pharmacists. The problem is that normally when a medicine's made, it's made in accordance with good manufacturing practice, and that's something that the regulator requires to make sure that the medicine is safe, that it's properly manufactured, and that it does what it needs to do.
And that's when it's done by a pharmaceutical company?
That's right. So companies that have a good manufacturing practice certificate from a regulator. The issue is with compounding pharmacists. They're not audited to have a look at the way that they're making medicines up. Essentially, they're regulation-free.
Professor Sue Davis has discovered some problems in her own practice.
The issue with the compounding process is that there is no quality control for individual preparations, and that the doses for these compounds are a bit of a guess. So no studies have been done to show what level of these compounded hormones are safe, and particularly what level is effective. So it's not just estrogen and progesterone that's being prescribed, but women are also taking compounds like testosterone, DHEA, pregnenolone, hydrocortisone, and the list goes on. And sometimes these combinations can be quite dangerous. When it's made up in this way, there's never quite the accuracy that we see in pharmaceutical grade products, where there's constant testing of the concentration of the testosterone in the product. I've seen instances on several occasions when women are taking compounded testosterone, for example, prescribed for them, and their blood levels are identical to what I would expect to see in a man, so tenfold what you would like to see in a woman.